Now, I remember growing up and taking sex ed and learning about all these different organs, and one of the organs that got surprisingly little attention was the prostate. You see, we learn all about the penis, the vagina, the ovaries, fallopian tubes, testes, all that good stuff, but we don't learn much about the prostate, and most people don't know what it does or even where exactly it is. So today, what I'd like to do is discuss the normal functions of the prostate. So the prostate is essentially a gland that's found right below the bladder, and the urethra as well as the ejaculatory duct pass right through it. As you can see, the ejaculatory duct and the prostatic urethra meet up within the prostate, and then they exit out through the penis. At the end of the day, the prostate is just one big gland. It's about 30 to 50 tubuloacinar glands combined, and its main function is to produce and secrete a fluid called prostatic fluid into the urethra. Prostatic fluid is this whitish fluid that's secreted into ejaculate, not to be confused with most of the ejaculate, which is actually produced by the seminal vesicle. This white prostatic fluid is full of different nutrients and chemicals that are supposed to support and nourish sperm, making impregnation easier, of course. Some of these molecules include fibrinolysin, prostate-specific antigen, citric acid, and acid phosphatase. Now, beyond that, the prostate is just kind of there to cause problems, right? You can get cancer in your prostate. Sometimes it can be inflamed or infected. And other times it can have this nodular benign proliferation called benign prostatic hyperplasia that can make it difficult to urinate. Now, one of my very intelligent colleagues actually posed an interesting question. If after childbearing years are over, the prostate is just kind of causing problems, it doesn't really serve a real purpose. So why don't we just remove the prostate in everyone to prevent it from getting cancer or infected? And there are really two reasons why we can't do this. One, of course, is cost. I've seen several prostatectomies myself, and they're, of course, very complicated and expensive. The other is risk. Now, remember, no surgical procedure is completely without risk. While prostate removals are fairly straightforward, you have to keep in mind that you're working in a very delicate area. As you can see here, we have all these nerves from both the pelvic plexus and the cavernous nerve that are helping to innervate the penis. Specifically, they're involved in erections. That's why erectile dysfunction is one of the most feared complications of prostate removal.